Very much, Vita Foods Europe team, for giving me this wonderful opportunity to talk one of the most important point that our industry is dealing today. How are we delivering our ingredients? Are they effective? Whether the molecule itself is enough for us to get the best benefit. And I think this is the most relevant. This is my 15th Vita Foods, and I can really see the shift in the industry has taken over these couple of years, or maybe last 3 4 years. It's not just the ingredient which is important alone, it's how we are delivering is equally important. So I chose my topic as how advanced delivery technologies drive consumer trust and brand growth. Ultimately, this is the most important positioning, and how consumers are getting these benefits, clinical benefits, and the efficacy that we are talking about. So, from science to strategy. So, the evolving nutraceutical market, I think the rapid growth in our industry we are seeing every day, how rapidly this industry is growing. 15 years back, when I was walking through a Vita Foods Europe show, it's not like this. The position of the ingredient is not like this. And even the clinical efficacy was started to emerge. And right now, without clinicals, you cannot walk into any show with an ingredient. And that's how our industry has grown to a level, and which is a positive side of it. And also, it's not just an ingredient, right? The shift from ingredient to performance based, whether your ingredient is performing well or not, how good the ingredient could be, but whether you are having a valid, clinically proven performance. Do you have a documented evidence for that? And that's a shift we are seeing from an ingredient to a performance. And similar label claims, you have the similar label claims throughout the entire portfolio, but the demand for the scientifically validated outcomes are more and more relevant, which you can definitely see if you walk through the floor. You can see the claims that you are seeing for each ingredient, whether it is a sports nutrition ingredient, whether it's an anti-inflammatory ingredient, whether it is a sleep ingredient, whether it is a longevity, which is an emerging field. You need a clinical outcome, which is a performance and published outcome. If you have a published outcome, yes, that's fantastic. Now, how do we position from ingredient to outcomes? Okay, whether it is enhanced solubility, stability, and improved bioavailability and absorption, and even we are actually looking at ingredient for a versatile application. Earlier, we used to see ingredient which are suitable for capsules or tablets maximum, but now see the industry has evolved. It is also considering these ingredients for beverage applications, gummy applications, food, even food applications. So in that case, if you want to see the performance for your ingredient, you need to also mask the unpleasant taste, flavor, and so on and so forth. So you are talking about an awesome. So it's not just about efficacy, it's also about consumability, whether the consumer are willing to consume in a different formats. That's also important. So for which delivery technologies plays an important role. Otherwise, you are not able to consume Bacopa or Bacosides in your daily beverage. You can only consume Bacosides because of its strong aftertaste in capsules or tablets. And then targeted and controlled release. Earlier, this industry has never seen a controlled release portfolio. It used to be in pharmaceutical industry, but even in nutraceuticals and food supplements, this technology is also going to come a big play. So these are the role of delivery technologies in making it more relevant for this industry. Let it be curcumin, let it be vitamin C, let it be ashwagandha. you need a little bit of delivery technologies to not just on bioavailability, it could be on improving the bioefficacy, and it could be improving the taste profile, it could be improving in the solubility of this particular ingredient into different format. And so the role of delivery technologies, it used to be only for improving bioavailability, not anymore. It's also extending into multiple roles to play. Okay? And now, what are those advanced so-called delivery platforms we are seeing? Liposomal systems. So if you walk to any shore right now, it's full of liposomes. So liposome became almost like a commodity for any advanced delivery platform you are talking about. But I'll come to that much detail in the subsequent slides. And nano emulsions, which used to be very sophisticated, but it is quite common right now. And then solid dispersion technologies and molecular complexation technologies, which is coming up very relevant in taste masking, also improving solubility. So the focus is delivering functional benefits, not just actives. So we are not talking about how much of active is into your serum. We are also focused on delivering what are the functional benefits am I getting by implementing this particular technology. So the technology is specific to the functional actives that we wanted to take. So for example, I was in fact researching on an ingredient beta-alanine, as you all know. I was helping a company for positioning it because beta-alanine is having a paresthesia. It's having a tingling and redness effect. So we have developed a technology which is actually eliminating or completely reducing the paresthesia effect. That's a perfect example of how delivery technology can play an important role on removing some of the bad sensory effect of a particular ingredient. So this is exactly the point. It's not just about bioavailability, it's about consumability of a particular ingredient and also improving the functional claim of particular ingredient. So delivery technology is taking a shift, completely bioavailability. Yes, of course, bioavailability is improving, but not just bioavailability, it's about consumability. So the focus is delivering functional benefits, not just actives. And now, let's talk about liposomes. So liposome is not something new, which we are now really talking about. Liposomes are invented in late 1960 by a British hematologist known as Alec Ben-Gam. So he never thought that he invented something which is a delivery technology. He was a hematologist, so he was playing with artificial or human-made cell. So he was, in fact, mimicking human cells, and that's how he invented these so-called tiny spheres. At that time, it was not at all known as liposomes. They were actually, his friend and Ben-Gam was having a coffee and said, okay, what do we call these spheres? Then the Ben-Gam himself said, we can say bangasomes. So initially they named it after him, and later they found it is not a good name. Because it's constituted of lipid particles, and som means cells. So it's a lipid cell. So since it is mimicking the human cells, that's why it's called liposomes. So at 1960s, when he was inventing, because he is a hematologist, he wanted to mimic the cells, and he never thought that it could be used as a drug delivery tool. It was subsequently, all the research found that, okay, it's mimicking the human cell, so it could carry some of the active into your intestinal barrier and get into the blood. And that's how the subsequent researchers invested time in modifying so many actives, pharmaceutical actives, to improve its bioavailability, reduce the toxicity. And that from then onwards, so much of research happened, and 1970s onwards, they started using as a drug delivery tool to improve the bioavailability of some of the drug and to reduce the toxicity. And as a result, in 1995 precisely, the first FDA approved drug known as doxorubicin, as approved by FDA to use in human consumption. It's for cancer therapy, as you all know. And even today, Doxil is consumed. And before Doxil, actually the liposomal doxorubicin, the doxorubicin is very toxic, having a lot of side effects when used in cancer therapy. But after this invention, Doxil is successfully used even today for majority of patients. So that's a great invention. And late 2000 onwards, where the emerging of food supplement and nutraceuticals started, we obviously had challenges. We had challenges in these natural products are completely complex chemistry than the pharmaceutical drugs. Obviously, we had challenges in bioavailability and obviously for bioefficacy. So from 2000 onwards, people started using liposomes as a carrier or as a vesicle to improve the bioavailability and bioefficacy of some of the complex molecules like curcumin and like also vitamin C. So people ask me, vitamin C is already bioavailable, why do you use this technology for improving bioavailability? But the thing is that efficacy and bioavailability are two different things. When you have a bioavailability measurements done, but it need not be bioefficient. So we may have to use the bioavailability enhancement technology for improving even for vitamin C. So obviously, so many natural products, people started working for improving the bioavailability. And what is the result? So as you know, the liposomes are spherics, like cells. So the cells are having protoplasm, which is water, in the center. Similarly, in liposomes, which is having a double layer, like as in the case of human cells, liposome having water in the center, and which makes the liposomes as a spherical form. And most of the liposome, right from 2000 onwards, which are consumed orally, are in liquid form, in syrup form or liquid form, because it has a liposomal structure and it can be used as an oral administration. The problem with oral administration, as you know, the liposomes are, the food liposomes are either constituted by soya lipids, soya lecithin we say, the phosphatidylcholine from soya, or sunflower lecithin, which is again phosphatidylcholine from sunflower. These liquid formulations are not that palatable, number one. Number two, these are not versatile. You have to use only oral as a drink or as a syrup. You cannot make it as a capsule, you cannot make it as a tablet, and you cannot make it in any sachet form, powder sachet form. This has a huge limitation, right? Those who don't like the taste of the lecithin, they will not consume it. And they will not consume unless until it is not consumable friendly. And even then, the market or the consumer outreach of liposomes were growing year on year. There's a tremendous growth. Why? Because of the efficacy, which you are never seen before when you use as a plain molecule or a plain extract. So the consumer wanted to get the benefit, but it was not a consumer-friendly approach. And then still people were using liposomal technology and producing. And then, as I mentioned, there was no lot of dry liposomal powders available at that point of time till 2014-15. I had a fortune of doing a PhD in Deakin University, Australia, and completely working on liposomal systems, where we designed an approach which could make liposomes stable. Remember that word is very important, because those who are using the terminology liposome, are they stable liposomal systems in a powder form? We may have to check that, the fact. So from 2014, we invented a technology, and recently we branded that technology as Metasome for making a differentiation, because there are so many liposomes which are calling liposomes. So let's get into the fact. What are they? So the classical liposomes having a structure similar to this, where there is an aqueous core and there is a lipid bilayer, and most of the time which you use for lipid encapsulation, lipid soluble active encapsulation, will go into the double layer, where there is a non-polar region, which is an oil soluble region. And if you want to encapsulate a water soluble ingredient, which is polar ingredient like vitamin C, that will go into the core of the liposome. This is a classical liposome. What are the advantages? You get an improved bioavailability and protection. It shields active from the harsh GI environment. So remember, when you consume anything, whether it is a medicine or whether it is a food, it goes through a harsh environment of having a pH below 2. First going into your gastric system, and then slowly pH is increasing, and then it reaches to the intestine, where the absorption takes place. And it can even do a target-specific release and absorption and reduced side effect. The lower the dose, the lower the side effect. And that's how we initially designed the doxorubicin in 1995 to reduce side effects. And now, the classical liposomes, what I was talking about, the so-called liquid liposomes, is having a physical instability. You may have to transport with specific temperature, specific humidity, and it could lead to vesicle aggregation, fusion, and breaking down during storage. And oxidation susceptibility, as I mentioned to you, the wall of the liposomes is made of phospholipids, which are prone to oxidations, and which will reduce the shelf life of any medicines or food supplements that you are talking about, and temperature sensitivity. There are also leakage issues, because these are very feeble bubble, where if you don't store it properly, there could be transportation of the actives to and fro of the liposomal system, because you are immersing the liposomal system in a liquid matrix, which is water. Poor scalability is another one issue, because earlier, maybe 15 years back, when there was only majority of the liposome existing in liquid liposome, the scalability was an issue, because you are doing thin film hydration method or any such method, where high pressure homogenization techniques, these are not easily scalable. And again, marketing misuse, unsubstantiated liposomal claim, that issue is still there today. We cannot remove that issue that easily. Only with the help of strong science we can eliminate this issue. And now we have introduced a metasomal system, where, remember I told you that the classical liposome having a liquid core, aqueous core. So if you employ any drying mechanism, whether it is spray dry or freeze dry or any drying mechanism, the water will go from the system. There will be a void in the core. When there is a void in the core, the entire liposomal wall will collapse and will make only a blend of phospholipids and the active by itself. And that will not make a claim of liposome. It will be only a blend. Now, what we have done is a structural engineering. We have designed an inert spherical structures, and which is elastic in nature, and introduced into the core of the liposome. Since it is a colloidal system, it can immerse in the water and organize. And once the water is removed from the entire liposomal structure, these spheres will reorganize and make the system like as it is, like a liposome. So, again, for a layman terminology, if you have a football in your hand, you puncture the football is no longer a football because it is a punctured sac, right? There is no air, there is no football. The shape loses, structural integrity loses. So again, if you again puncture the football and through the hole you fill some small rubber beads, the football again becomes like a football and it will regain its structural integrity. And that's how we are doing in a molecular level. When you do that in a molecular level, each liposomal structure is intact its structure. And when you see after the drying mechanism, when you get a powder, you examine with a cryo-TEM and SEM, you will still see the liposome, the liposomal double layer. You must see that because that's the only way you can assess a liposome, without which, by optical microscope, you cannot assess this liposomal double layer structure, liposomal integrity. And we have to do a thorough investigation to understand the structural morphology. So we usually, to judge or validate the liposomal structure, we use cryo-TEM, we use SEM, we use DLS, which is showing the particle size distribution. We also use zeta potential to assess the charge and the stability of the system. And lastly, we use AFM, which is atomic force microscopy, to understand the morphology of this structure. And this is very important, and then only we can say these are proper liposome. And what are the effects? So when you properly design a liposome in a powder form, which will be regaining its structure and aqueous core after reconstitution in the gastric system, you have a very superior scalable product, which is a versatile. You can use in capsule, tablet, sachet, gummy. We recently published a paper on gummy application. So you have a structured, stabilized structure and enhanced long-term stability, even in the liposome form. So we have done shelf life studies, not just for actives, for the liposomal stability. Day 0, what is the liposomal stability, what is the DLS value, what is the zeta potential, and after the end of shelf life study, what is these values looks like. It's very important. You may have active ingredient intact, but you may not have a liposomal integrity at the end of the shelf life, and superior reproducibility, which is very important. But because when you have a liquid liposomes, I am not degrading the liquid liposome either, but to understand better, this technology can scale, retain, reproduce. And then industrial scalabilities, we produce tons of these products. The kind of scalability is enormous, and ambient storage capability. We are transporting at room temperature. We don't need to use any temperature-controlled vessel or capsule shells. We can use as you do. Then there is a question, many other liposomes are doing this, but are they liposome, which you need to validate using the so-called sophisticated analytical tools. That's very important. And you can only build a credibility through research and validation. How do you validate research? At this point of time, the only way to validate any research is peer-reviewed publication. Without peer-reviewed publication, your research could be best, but I cannot say that. Because if I do a research and I say that this is a first class, who validated it? Who peer-reviewed it? So the peer review mechanism is so important. We have many peer-reviewed publications on metasome, which is a tiresome process. If you do one peer review journal, sometimes you feel frustrated. The kind of reviewer comment you get is really frustrating. But we worked on it, and make an impact. When you make an impact using this research, only when a peer review happens, because peer review usually we publish in American Chemical Society and Royal Society of Chemistry. So at least 4 reviewers, it goes, come back, negative comments, we work on it. They may need to do additional experiments. Okay, we are capable of doing it, we are prepared to do it, and that's the only way we do it. The marketing gimmick will not help for sustainability. It will only help to position you somewhere, but you won't stay there, because you can stay there and consumer feel the benefit, and ultimately it is going to the consumer. Ultimately, consumer need to get a benefit, health benefit. Only if there is a good amount of data in you, statistical significant results, that only will help. And the mechanistic understanding, clear scientific rationale for enhanced bioavailability and efficacy, and you do that, and then you publish. And batch-to-batch reproducibility, we never release any new product without going a scale up 3 batches. If you do that, you may fail. Clinical and preclinical data. And these are the clear clinical advantages: improved bioavailability, lower effective dose, faster onset of action, better consumer outcomes, so on and so forth. And let me talk a little bit about the commercial advantage: the premium pricing opportunity, strong product differentiation, enhanced market position, and improved customer retention. And these are commercial angles. This commercial angle will only come when you satisfy the scientific and clinical advantages. And that's it. Winning the future nutraceutical market is only through improving the delivery mechanism. Move beyond ingredient marketing, invest in performance-driven delivery system, focus on consumer experience and outcome, leverage technologies. Not just metasomes, but any delivery technologies which is validated by clinical and bioavailable claims. You can use it and make one ingredient which is existing for last 20 years. Maybe you can do much better ingredient using delivery technologies. Okay, thank you very much.